Hello everybody. In this video today I wanted to speak about how and why I ended up getting testing for Lyme disease to try and find an explanation for my chronic illness. This is a bit of an intensive journey. It was 2 years ago now that I first got Lyme testing, but I actually had suspected Lyme for 2 years before that, so Lyme has been part of my life now for quite a while. But I wanted to make this video because it does make me sad that a lot of people probably have Lyme disease but undiagnosed. So yeah, I'm going to tell you what eventually made me realise that Lyme should be looked into and how to actually get accurate testing in the UK, because unfortunately the NHS testing isn't fully accurate because one, it just tests for antibodies originally, the first line. There's actually 2 tiers of testing under the NHS, but if you don't kind of get a positive on the first tier, they won't really go to the second one. So a lot of people who are actually so sick because they're immunocompromised, their body can't even create the antibodies against the infection, they will test negative even if they have Lyme disease. And secondly, the NHS Lyme tests, they obviously test for Lyme disease, which is Borrelia burgdorferi, but there are other strains of Borrelia that can resemble Lyme as well that should be tested for, but aren't routinely tested for unless you get overseas testing done. My journey actually starts early on in my childhood, because if you've been watching my channel for a while now, you will know that I grew up with sudden overnight onset OCD, very severe, and also tics, sensory processing issues, rages. By the age of 17 I found out that these were actually PANS. They were caused by PANS, which is infection triggered brain inflammation, specifically the basal ganglia. And yeah, so turns out it wasn't all just innate neurodivergence, it was a medical condition that was causing all of this. And that's really where the journey to looking into what infections contribute to this started. I already knew that I would flare with pretty much any infection, but especially throat infections, so at that time it was kind of looking more like pandas. But, you know, I was flaring with viruses as well, so there was something else going on. But it was when I was 18 that I started considering Lyme disease, because I developed so many more health issues at 18. I developed POTS symptoms, and technically I think that I've had POTS since my childhood, because when I was 10 years old, I went through a phase where I couldn't brush my teeth because I couldn't actually stand up for long enough. I had to brush my teeth sitting down. And then when I was 14, I had issues with low blood pressure and almost passing out and standing up. So I feel like I probably actually had POTS for longer, but it didn't become a real problem until I reached the age of 18. That's when it became totally disabling. As well as that, at 18 I developed severe muscle fatigue that was honestly debilitating. I would have to strain to breathe because it was like my diaphragm was so weak. Every time I took a breath in, it was as if I would have to like pull up a hammock of sand inside my chest to breathe. It was really difficult. And that would impact my sleep, because I would literally go to bed and after a couple of minutes I would wake up and gasp for breath because my body didn't have the strength to even breathe through my sleep, which was really concerning. And I remember I once woke up and took my blood oxygen, it was 93, which is quite low, so it was really concerning that I was even struggling to breathe during my sleep, because in the day I could strain to breathe so that I could get enough oxygen in, but at night, you know, I didn't have the strength to strain to breathe because I was asleep. I couldn't force myself to breathe. I also found it hard to sit up for long, because if I sat up my muscles would honestly like cramp up. They would feel like they're semi-cramping all the time, just trying to get me to like hold me up. And I remember going to my friend's house and having to like sit on the floor and lean against her bed to stay upright, because I couldn't even sit like normally cross-legged. Or, you know, if I was sitting on a chair, I had to end up getting a new chair in my bedroom that actually went up to here so that I could just lean on it, because I didn't have the strength to hold myself up properly. Unfortunately, doctors didn't really take this seriously. I remember them saying, well, if you don't fully flop, then it's not a problem. As in, like, if I don't completely flop over, then it's not an issue. But there was still an issue in that I needed environmental adaptations to hold myself up, and that isn't typical. Like, you're supposed to be able to hold yourself up without your muscles literally straining and almost cramping. And also the breathing difficulty. Doctors didn't take that seriously either. They were like, well, everyone struggles to breathe sometimes. And I was like, yeah, but not for 8 hours at a time, not to the point where they have to strain to breathe and aren't getting enough oxygen in their sleep. But like, doctors can be so dismissive, especially if you're a young woman with a history of mental health issues. They just assume everything must be all in your mind. So I wasn't able to get any answers really, and it was absolutely terrifying because I was just losing more and more of myself. I was getting so weak that I couldn't do anything I enjoyed. All of my focus had to go on just breathing and keeping myself upright. And I also developed heart palpitations where my heart would like skip beats or add in extra beats randomly, which is really concerning. And again, like, it was hard to get taken seriously because doctors just assume that's anxiety. I did have an ECG and it said there was sinus arrhythmia and sinus tachycardia, but they didn't really look into that as much straight away. So I kind of just suffered with it. And then I ended up also, nausea was a big issue as well. I was like really nauseous all the time, and sometimes I would have episodes of just vomiting all the time. It was weird because like it would come in like episode flares. I would have symptoms all the time, but this nausea and vomiting would come in flares alongside severe neck pain and light sensitivity. And there was one time when I was 19 years old, it was March 2022, I think. I was like really ill. I was bedbound for 3 weeks because if I even sat up, I felt like I was going to pass out and I could barely breathe. It was so hard for me to get a breath in because I was so weak. And that started with the nausea and vomiting, and literally I just turned my head in bed and I vomited. It was that bad. I couldn't even turn my head in bed without vomiting everywhere. And that was terrifying because my mum thought that I might have meningitis, but at that point I was literally 19, yet I decided I'd rather die than be, treated terribly by a doctor again, medically gaslit. So I ended up just dealing with it and hoping that it will pass, but also I was like, if I die then fair enough. I kind of just lost all hope at that point. And yeah, my blood pressure as well was always very, very high, but especially when sitting or standing. And that was really concerning because when my blood pressure was really high, I could literally, if I looked at a wall, I could see a silhouette of like my blood vessels, and I would sometimes lay down and like I would lay on my trampoline in the garden sometimes because I wasn't really able to use the trampoline as much because I was very weak. But if I would lay on it to try and rest at least in the garden, it would vibrate the whole trampoline, the strength of my heartbeat. So that was really weird and scary. And I feel like I've kind of blocked some of it out. I just know that it was utterly horrendous and I genuinely thought I was dying. And I originally, I went, how did I forget the most obvious thing, like the eating thing. I would have to eat very frequently to keep up some of the strength, because if I didn't, I literally couldn't even hold my head up. I had to use a neck pillow to help me hold my head up sometimes, and like my strength would be regained slightly after eating something so that I could be upright a little bit more, find it slightly easier to breathe, hold my head up a bit better and stuff. But it was getting to the point where I literally couldn't do anything. I couldn't go outside. I couldn't do a video call without feeling like I was going to pass out and needing to eat to address that. And at first the doctors thought I might have low blood sugar. Well, actually they didn't think I had low blood sugar. I bought a blood sugar monitor myself because I had been to my GP and they run basic blood tests 4 times, and every time they were saying, well, your basic bloods are normal, so there's nothing wrong with you. So I was just being left to suffer really. And it wasn't until I just bought myself a blood sugar monitor and it came back abnormal that I eventually called my GP. But then they actually got a paramedic in touch with me who told me to go to A&E. But then the test there for blood sugar came back normal, so they said it's just because you're vegan. I stopped being vegan, only very slight improvement in that respect. Overall still very ill, very disabled, didn't do much. And I would literally also lose any ounce of emotional regulation when I was even slightly hungry. Like I remember rolling around on the floor screaming when I didn't get to eat for a few hours, and that wasn't just me being a brat. I mean, I was an adult at the time. I'd literally lost all emotional regulation. There was a time where I was backing my head against walls because I lost emotional regulation when I was hungry. I even struggled to speak at one point when I didn't eat for long enough. I had to have a constant intake of food so that my brain could work and my muscles could work. And because my blood sugar kept coming back normal, doctors wouldn't take it seriously and they wouldn't really believe me. I lost, basically, it was when I was 20 years old, and I eventually went to the walk-in centre. By that time I'd had to start using a wheelchair because I was so weak and I was struggling to walk long distances. I went to the walk-in centre that day because I literally knew that I felt like I was near the end. I felt like I was about to die because I was up vomiting all night. I'd barely slept. I could barely breathe. I was losing sensation. I also had episodes of loss of sensation throughout my body, sometimes certain parts, sometimes my whole body. And I ended up just going to the walk-in centre where they said I had a high heart rate, high blood pressure and a high temperature. and the doctor there was actually quite concerned because I told him that I had been referred to a neurologist, but they expected me to wait over a year. Meanwhile, I was deteriorating and felt like I was dying. So obviously they were quite frustrated by that, not by me, but the doctor was actually really empathetic and said, like, it's not right that you're being made to wait this long. So I was completely dysfunctional, and the doctor said that I should have my appointment with the neurologist expedited, so brought forward, so I can see them sooner. But when they realised how high my heart rate was, because I'd actually been tracking my own heart rate for months, I hadn't told my GP because I knew that they would just dismiss me and not take me seriously. But I showed the doctor at the walk-in centre pictures that I'd taken of the pulse oximeter and my heart rate often being around 140 to 160, and he was really concerned by that, and he was like, you need to see a cardiologist. I also showed him my blood pressure. I'd also been tracking my blood pressure. I basically just had to figure everything out myself because my GP surgery was just neglectful. So they never considered taking my heart rate or blood pressure or anything. They do the most basic blood tests and be like, well, they're normal, so you're fine. So I ended up having to just track stuff myself and try and figure it out myself. But thankfully this doctor at the walk-in centre was amazing, and he was very validating, and he actually phoned my GP surgery to ask if they can call me so I can have an appointment, because I struggle to make appointments myself because of my autism. Like, I was just like, you know what, I'll just die easier than making a phone call. And I yeah, it was kind of funny though, because the doctor at the walk-in centre was literally rolling his eyes when he was on the phone to my GP surgery, because like that's literally how I feel when I'm on the phone to them as well. And I mean, for context, my GP surgery was rated as requires improvement by the Care Quality Commission, so everyone knows they're not great. And it was just kind of funny to see that a doctor who actually felt the same way as me and was frustrated by the system. And it was really concerning though, because he also said that because of my frequent eating, he was concerned that I could have an insulinoma, which is a pancreatic tumour, and he wanted me tested for that. And he wrote me a prescription for anti-nausea medication and wrote suspected insulinoma on it, and I was quite concerned by that, because it's like, oh, you think I might be dying, wonderful. They also said there's a chance I might have multiple sclerosis or motor neuron disease, although I knew it wasn't the latter, because my weakness wasn't that progressive. It would come and go in episodes a little bit. I mean, it was kind of always there, but the severity would fluctuate. But I was concerned about MS, just because my mum and uncle had also brought that up as a possibility. But it was very dark for me at that time, because I felt like if I did have like a progressive form of MS, then my only option would be, you know. So it got worse after that. My health got worse, and I ended up not sleeping for days pretty much, because I could not breathe in my sleep, and I was losing strength more and more over time. I forgot to mention this bit when I was filming, but I also, in that bad flare, I lost sensation in my hands completely for a while. It was like there were just clumps of meat stuck to my arms that didn't really belong to me, which was really scary. And I remember I also had this thing where my legs below my knees were ice cold and were cramping as if there wasn't enough blood going to my extremities, which was really, really concerning. There was also this thing where I felt like my perception of my body had been messed up. It felt like my body was stretched out, like I was longer than I really am, and it's really freaky. Trying to force myself to breathe, I'd have to splash cold water on myself to kind of shock myself to make myself breathe, and meanwhile doctors didn't seem to care. And I knew a young woman who had gone to the doctor for a very similar issue, and they had just been told that, oh, you're probably making it up or something. So I had no hope in the medical system at that point, because I'd already been neglected by them since childhood, so run out of hope already. But I did have a bit of hope for the neurology appointment, thinking that, well, the neurologist surely should take me seriously and know what's going on, because they specialise in this kind of stuff. But I was very wrong. That made things worse, because I was literally just in the neurologist office for 5 minutes, and he checked my reflexes and said, well, they're fine, so, you know, there's nothing wrong with you. And he did make me do a sort of exercise where I'd have to like lift my arms and stuff, and I did say, like, because it felt like my shoulders were kind of cramping from doing that, and I did tell him that, but he just was like, well, no, you don't have muscle fatigue, it's normal. And he basically I was actually begging for help because I could barely breathe a lot of the time. My vision had also changed. I was seeing everything in a kind of yellow tint. I was so nauseous all the time. I was overheating all the time, except my hands were freezing cold. Like, there was definitely something going on. And unfortunately, this neurologist just said, oh, there's nothing wrong with you. It's just a difference in perception because you're autistic. You're perceiving that there's something wrong with you when there's not. And I was like, this is ridiculous, because I literally have physical evidence that my heart rate and blood pressure fluctuate so much to the point where it's kind of dangerous. And I also, people could tell because my skin would slightly go yellowish in a really, really bad episode when I was really, really weak. So it was just wild to me that the neurologist assumed that nothing could be wrong with me because I'm autistic and it's probably all in my head. And I was literally begging. I was like, can you please do a brain MRI at least to rule out MS, because some people thought I might have MS. And he was like, I don't want to do a brain scan because it will make you think there's something wrong with you. And I was like, well, I wouldn't be here if there wasn't anything wrong. But yeah, that appointment traumatized me, because at that point I felt like, well, I was just going to die and no one's ever going to help me or believe me, so oh well. It's literally a living horror story, like a living horror film. Your body is giving up on you and nobody believes you, so no one will help. I mean, my parents believed me, but there wasn't much they could do. And it got to the point where literally some of my family members were so distressed, yet the doctors obviously didn't care. So you can see my legs, wait, you can't see, but my legs are really jiggling at the moment, like, it was a very hellish time. And he wrote on my medical file no evidence of muscle weakness or muscle fatigue, despite the fact that that was literally my most debilitating, dangerous issue. So turns out though, this neurologist didn't just do that to me. I managed to connect with another young woman in the area who had seen the same neurologist. She's also autistic and she had the same sort of experience with him, and it nearly killed her. But by that time I knew that the NHS weren't going to be any help to me anymore, because it would be like another year's wait until I could see a neurologist again, and they'd probably have the same kind of attitude. So because this neurologist was like seen as one of the best neurologists in the UK, he is a senior lecturer at one of the most prestigious universities, and he was like the head of the neurology department at the hospital. So I felt like no doctor would ever take me seriously if he, just from 5 minutes of seeing me, decided that there was nothing wrong with me. So I knew that I would either just die or take matters into my own hands. Thankfully I had the sort of determination to do the latter, and I knew that Lyme disease is quite common in people with PANS, and although I had never noticed a tick bite or seen a tick, I thankfully knew that not everybody with Lyme does, because ticks often bite in places that you wouldn't really notice, like on your scalp or backs, places that you wouldn't see, and also you don't tend to feel it when a tick bites you because they release a numbing agent when they bite. So I knew that just because I didn't have any recollection of a tick bite, that didn't make it impossible. And I also knew that Lyme disease can cause many neurological issues. It can resemble ME, myalgic encephalomyelitis. That's one of the most common misdiagnoses for people with Lyme or related strains of Borrelia, because Lyme is caused by the bacteria called Borrelia burgdorferi. So I just knew that I should probably test for this because it's so common in people with PANS. It can cause neurological issues, it can cause severe muscle fatigue, it can cause visual issues, it can cause liver issues, gut issues. Like, I was reading a list of symptoms of Lyme disease and I was like, I have most of the symptoms, like the neurological symptoms of Lyme, so I should at least look into it, because I was actually running out of hope. My mum wanted me to use the little bit of money I had to pay for a private neurologist, but I just felt like a neurologist would be just as dismissive as the last one. So I felt like, for some reason, I just had this really strong hunch that I had Lyme disease and that Lyme testing would be the answer I needed, because I'd been suspecting Lyme for 2 years by that point. And I remember when I was 18, like 2 years before all of this, I was crying my eyes out because I couldn't afford Lyme testing and I thought that I had Lyme. It took me deteriorating and being neglected by the NHS to the point where I realised that I have no other choice. I had to get Lyme testing. So I ordered through the Academy of Nutritional Medicine. They offer testing from Armin Labs, which is a lab in Germany. You don't actually have to travel to Germany for it. You get your blood drawn in the UK but send that to Germany. So I made an appointment with a private clinic because my GP surgery wouldn't take the blood, and I went for the blood test. And then when I got the results, I was literally shaking because I just felt like this was going to be something really important. This was going to be transformative for me. I just already had that sense. And when I opened it, I was right. 3 out of 4 antibodies were positive to the bacteria that causes Lyme disease. And although that can't technically prove that my illness is caused by Lyme, because the antibodies could be caused by past infection, but I felt like it's worth at least trying Lyme treatment and see if it helps, because I literally had no other option at that point, and I was still deteriorating and things were hellish. So I ended up seeing a Lyme clinic, and they said that I could either go on ceftriaxone, which I think is actually an IV, but that was only if my brain scan showed abnormalities, which it didn't, or I could go on I think it was doxycycline, azithromycin and cefuroxime, something like that. It was a triple antibiotic combination. However, I could not afford triple antibiotics and all the follow-ups needed. That's not the clinic's fault. They're amazing. They're actually really well priced. I was just poor. And the NHS don't treat chronic Lyme because they don't believe in it. They don't treat late-stage Lyme, even though over 700 peer-reviewed studies show that Lyme and related infections, like co-infections, can persist despite antibiotics. Johns Hopkins acknowledge that a persistent infection may be the cause of this. And also studies show that 21 days of antibiotics, which is the usual amount given by the NHS, actually isn't enough to kill off Lyme for everybody, especially not for someone like me who had been so sick for so long, with all the neurological symptoms and stuff. And although if you have proof of neuroborreliosis under the NHS, you can get, I think it's like 6 weeks of IV antibiotics, but because my symptoms might not be neuroborreliosis, they might be more related to the peripheral nervous system rather than the central nervous system, I just felt like they wouldn't take me seriously. And also I didn't really want to go for a spinal tap because I have like potential connective tissue issues, and for some people with this kind of issue, if they get spinal tap, it can actually just cause a spinal fluid leak, which I didn't really want to risk. So I was like, well, I just was like, I'll try whatever I can. The NHS probably aren't going to be able to help me, and the Lyme clinic were great, but at that time, not only could I not really afford the long-term antibiotics and stuff, but I also had really bad gut issues. Like, my guts were awful. I was just vomiting so much. I felt like antibiotics would make that worse because they can disrupt the gut microbiome, and a lot of people have gut issues on antibiotics. I'm just laughing because I literally took antibiotics for 7 days and I had the worst diarrhea, and that caused so much dehydration, which is bad for me because I have POTS. So obviously I was reluctant to go on the antibiotics at first, and I felt like there must be another option that I can afford and that will be safer for me, that also will be gentler on the body and not cause a severe Herx reaction. I ended up connecting with a friend of mine who had suspected Lyme disease, and they had a friend who had confirmed Lyme disease, and they said to look into the I think it's Buhner Herbal Protocol, or it's Buhner, but I think it's Buhner. I'm not sure how to pronounce it. I'll put it on the screen. But basically, that I'm aware sounds very like quackery because herbalism isn't really that well recognized, but I didn't really have another option at the time. I couldn't afford anything else. And also, at least it was gentler on the body than antibiotics. It wasn't going to cause as many gut issues or a severe Herx. So I felt like it's better than nothing because, again, it's either do or die. You either try it or you deteriorate and you have no quality of life. And I literally felt like I was dying, so didn't really have a choice. So I tried it because it is evidence-based. Studies show that certain herbs like cryptolepis or Japanese knotweed can actually work better for Lyme than the conventional antibiotics. And that will probably be because some strains are antibiotic resistant. That's another reason why I was quite happy about the herbs, because my blood test did reveal that I had round body forms which have higher levels of antibiotic resistance, so it's probably a good thing that I at least tried something other than antibiotics as well. Some of the herbs as well have also got proven anti-inflammatory properties. Andrographis inhibits interleukin-6, which is often found at high levels in the nervous system of people with neurological Lyme. So I'm really grateful, because overall the herbal protocol did save my life. It reduced my symptoms by about 25%, which might not seem like a lot, but that's 1 in 4 symptoms either gone or dramatically reduced. So from that, my irregular heartbeat stopped. I still have POTS, I still have a high heart rate and blood pressure issues, but I don't have the random heartbeats or the skipped heartbeats anymore. I do still have like muscular issues, like severe muscle fatigue, but it's like 50% milder. I do sometimes strain to sit up, but it's much rarer than it used to be. I also don't have breathing issues anymore, thank goodness. I don't have as much difficulty speaking anymore. Like sometimes I'd have the speaking issue because either I was so hungry that my brain couldn't function and get me to speak, or like my muscles just made it, I had to tense to even get words out. So I've seen quite a lot of improvements, and I'm so grateful for that. And what else was it? Swallowing issues, I forgot to mention that. The weakness was also caused swallowing issues, where I would like choke on things and cough loads when trying to eat sometimes, and thankfully that is dramatically reduced as well. I don't have constant nausea anymore. I have it sometimes, but it's not constant like it used to be. I also don't overheat constantly like I used to. I no longer wake up 4 times in the night to eat. I do still have to eat frequently sometimes if I have overexerted myself and I'm in post-exertional malaise. I found that my excessive intake of food, yes, it led to weight gain, you can probably tell. That was probably my body's attempt to at least get some form of cellular energy to keep my muscles functioning. So thank God Lyme treatment made that milder, because I was exhausted by getting up 4 times a night to eat, because my body would keep waking me up, and I felt like I was dying if I didn't eat. Like adrenaline surges and stuff, and severe weakness where I couldn't breathe. So, you know, I'm so grateful that worked. It saved my life. And I know herbalism is controversial, but to be fair, loads of people with Lyme have had the same positive experience. I also do not experience loss of sensation anymore. I don't experience the thing where my limbs, my extremities are ice cold. My skin doesn't go as yellow anymore in bad episodes. Although I still have issues with high blood pressure, it isn't as persistently high. I feel a lot happier within myself in general. No longer have the severe vomiting episodes, which is amazing. I don't need a neck pillow anymore to hold my head up. I can sit up without leaning on stuff more now. I can obviously breathe properly, as I said. With that, and you know, studies do back it up, and I am obviously aware that the results in a test tube aren't necessarily the results that it will have in the human body, but thankfully it does seem to work well for us. But as I said, like, although 25% of symptoms had reduced or gone away, I was still struggling a lot with post-exertional malaise, gut problems, especially bloating and reflux, and obviously POTS as well, and migraines are a big thing for me. So I ended up also going on low-dose naltrexone, which is an immunomodulatory medication that it basically increases your natural level of endorphins in the body, which supports immune function. It's often used for autoimmune diseases and things, and some people with myalgic encephalomyelitis have also seen benefits from it. It's really hard to get prescribed under the NHS because it's off-label for many things, and it's also like, I have to get it from a compounding pharmacy because I have to have a really, really low dose, and I will get onto that. I had to titrate very slowly because I had a bad reaction initially, and it's really hard to get NHS prescriptions sent to a compounding pharmacy because there's not that many in the UK, so I do unfortunately have to pay out for that as well, but thankfully I am able to afford that due to my PIP, Personal Independence Payment. It's a disability benefit given to people in the UK that helps them cover the extra costs associated with being disabled. So for me, it's obviously my LDN and Lyme treatment, because that saved my life. And but with the PIP cuts, that's obviously going to cause a lot of people like me to struggle, and it will cause some people from not being able to get the treatment they need at all, because the NHS actually doesn't always help us in the way we need to be helped, and it's really sad. But yes, sorry, I've gone on a bit of a tangent. LDN, yeah, at first it made my tics worse and fatigue worse, so I was kind of scared of it, and I had a flare like right as I started it, and I thought that was caused by the LDN, but it might have actually not been, where my thinking was really irrational, so I was actually really afraid to continue the LDN. But thankfully, I was able to rather than start on 0.25 milligram, I started on 0.1 milligram and titrated extremely slowly. And the reassurance from the doctors helped, because they did say, like, it's normal for it to kind of increase fight or flight at first, because your body is confused, like, what is this new chemical in my body? What is this chemical trying to increase endorphins? What is this? But thankfully my body did adjust to it. And although I'm only on 0.8 milligram now, as I said, I've titrated very slowly, I think I've noticed some benefits, particularly a reduction in gut problems. I don't feel like I have as much bloating, which is helpful. And I've noticed as well that I have a little bit more of an ability to use my muscles without them cramping as much. Because as I said, the herbal interventions reduce that by about 50%, but I still have some weakness and muscle fatigue. But I'm able to do writing and colouring now for longer without my muscles cramping up, without feeling I'm going to pass out from using all of my energy. So I'm very grateful for that, and I'm looking forward to seeing what further improvements I could see as I slowly titrate and increase the LDN. But also, let's get more into the actual Lyme testing. As I said, I used Arming Labs. I had the TickPlex panel, which I thought was a really good test, but it was actually an antibody test, meaning that if I was immunocompromised and my body couldn't even create the antibodies in response to the infection, it would have come back with false negatives. I'm just so lucky that it actually came up positive, because otherwise I would have just given up hope and stopped looking into Lyme, and you know, I hate to think where I would have been then, but I'm just lucky that it came up positive. They do other options like the ELISpot that I don't think rely on antibodies, so they are the tests that I think I'd actually more recommend, especially if there's any chance that you might be slightly immunocompromised or immune dysregulated. Your immune system might not create antibodies to the infections it's supposed to or something. The issue with the Arming Labs testing was that they only tested for one strain of Bartonella Hensley, but there's actually many different strains of Bartonella vinzoni, Bartonella contana, and Bartonella elizabethae. But there's a lot of different strains of Bartonella, and they're all important to look into because they can actually all cause problematic symptoms, especially neurological and psychiatric. Some of the core Bartonella traits, there were things like depersonalization and derealization, shin pain, pain in the soles of the feet, and a rash that looks like stretch marks. So if you have any of those, potentially look into Bartonella. But that's why, as well as that, the Lyme clinic that I went to said that I might have Borrelia miyamotoi, which interestingly has been linked with myalgic encephalomyelitis symptoms, which would explain why I experience so much post-exertional malaise and ME-like symptoms, although I don't want to get an ME diagnosis because I believe that would lead to further medical neglect. It would just be an explanation of the symptoms and not the cause, so it wouldn't really open any doors to treatment for me. I just wanted to add in some of these snippets from the ME research website because I think they are really important to read and look into. Case studies have shown that some people with ME have recovered with Borrelia miyamotoi treatment, and other studies have linked it as well. The symptoms do overlap quite a lot. And also because Borrelia miyamotoi is also known as hard tick relapsing fever, the symptoms can kind of relapse and remit a little bit, which actually would make a lot of sense for me, because although, as I said, I have seen benefits in the interventions I've already used, my quality of life used to be 1 out of 10, now it's 6 out of 10, which is pretty good, although it really depends. I do still flare, so in a flare it's 5 out of 10, and then normally it's 6 out of 10, but I do still have episodes where ever since May of last year, my symptoms have followed a pattern where 3 weeks I feel really well, not really well, I still have symptoms, but compared to what I used to be, 3 weeks where I'm slightly more functional, and then 3 weeks where I am unable to do anything and I can just be really unwell, struggle with anything, and that makes basic things difficult. That's not to say that when I don't have those 3 week flares that I'm completely fine, because I do still need to pace and be careful with my energy, and I can still struggle with migraines and stuff, but it's not as severe as those 3 week flares that I get. So it's 3 weeks good, 3 weeks bad, 3 weeks good, 3 weeks bad. And I feel like a relapsing fever tick-borne disease could potentially explain that kind of pattern. Some people said it might be related to my menstrual cycle, but it wouldn't follow that pattern of 3 weeks and 3 weeks. It'd be 3 weeks then 1 week or something, I feel like. So I plan to get tested for Borrelia miyamotoi at some point. Arming Labs do a test for that, but it wasn't included on the TickPlex panel. But also there are so many other strains of Borrelia, like Borrelia guarini, Borrelia mayoni, and that's why in the future, well, I say in the future, it's in a few months, I'm supposed to be getting retested, but specifically for co-infections, to see if there's any co-infections that might need treating that may have not responded to like the Lyme herbs, because they're evidence-based for Lyme but not necessarily for other strains or co-infections, so I might need further treatment. I am hoping to get Vibrant Labs testing because that is very, very thorough. In fact, I think I would recommend that over Armin Labs, just because Vibrant Labs and IGeneX as well, they're American labs, but they test for way more strains of Borrelia, way more strains of co-infections, whereas Armin Labs just tests for like one strain of Bartonella, or at least on the panel I did, and one strain of Babesia, but there's actually many different strains. So I have found a doctor in America who I might be able to order the lab tests through, and they might be able to like send it to me, and then I can take the blood and then have it sent back to America for analysis. That might work. Some people in the UK have had that done, and that could give me an idea of whether I have co-infections. And I'm also getting neurological antibody testing as well, which could rule out certain autoimmune neurological diseases. These neurological antibody tests, like, they're not really done that often by the NHS. A lot of people with these sorts of issues will just be misdiagnosed with FND or ME and left to suffer. So I'm really grateful to be able to be getting this testing done now. It will test for things like anti-dopamine receptor antibodies, which can be associated with pandas and pans, although it wouldn't like rule out pandas and pans if it came back negative. It's more just that it's present in a lot of people with pandas and pans, but there are other things, markers that can be present. That's why what used to be known as the Cunningham panel, now known as the autoimmune brain panel, has other markers as well. But I'm also really interested in the anti-acetylcholine antibody testing, because that can be associated with a condition that causes very, very severe muscle fatigue that is alleviated by putting cold, like ice or cold water on you. So I'm very interested for that as well. You can get that test under the NHS, but that depends on whether a neurologist actually listens to you and believes you, which in my case they didn't. So unfortunately I have been forced to go private, but thankfully I've been saving for quite a long time now, and I have family support and stuff, so thankfully I should be able to get this testing. So future plans are, if one of these Vibrant Labs tests comes back positive for a co-infection, then I am planning to try an antibiotic combination, because although the herbal protocol, as I said, it really, really helped, there are some residual symptoms, and the herbs might not address co-infections because they're just evidence-based for Lyme, and some for Bartonella, but there also are other strains and things. So I would like to try the antibiotics, and also I'm considering things like peptide therapy, which is kind of experimental, but I know a lot of people with long COVID who've actually seen benefit from certain peptides, and obviously I would be doing that with a doctor who specialises in this stuff, because otherwise you're just injecting yourself with random stuff that you buy off the internet, and I don't really recommend that because that can be quite dangerous. But no, I would see a doctor for it, and they supply it. But that's also just like an option. There are other options as well, but I think those are things I'm going to be looking into first, because it would be amazing if one day I can regain some more functionality. I would love to be able to work at least part-time, because like filming a video like this, you probably noticed that for the past year or maybe 2 I don't upload as regularly as I used to. It's because it takes so long for me to get over the 3-week flares and get the sort of strength back to feel like I can film a video like this, because sometimes it's just not possible for me to film because I get post-exertional malaise and it triggers horrendous migraines, and I'm literally having to recover for days after filming. So I wish that one day I could be well enough to at least work part-time. Like, I'm not sure if I would be well enough to work full-time or not, but I mean maybe, but I would have to start from part-time and see how I go, really, because I'm also neurodivergent. I also struggle with the demands of daily life as it is. But I do wish that I could have a more normal life, and even university, I would love to do like a remote university course one day. I'm not able to do that now just because, as I said, like, everything is hard for me. Even like obviously the 3-week flares that I have, I can't really do anything, but even the 3-week flares, but the 3 weeks where things are better out of the flares, I do still have to manage my energy, because I can still go into post-exertional malaise and feel really run down and headachy and stuff, so I do still need to be careful. But if there comes a day where I am more functional and my health is more reliable and I could do like everyday studying or something, then I would love to do a university course. Yeah, I'm just thinking, like, could my life be normal? I don't know. But to be fair, I'm obviously very, very grateful for where I am now. I'm so lucky that I didn't end up deteriorating. It wasn't a pancreatic tumour. It wasn't something that was neurodegenerative or anything like that. I am really lucky and grateful. But I would not have had these improvements if I didn't know about Lyme and co-infections. So that's why I'm so passionate about raising awareness of this stuff. I don't raise awareness of Lyme to, like, scaremonger or anything. You can see I still go outside and stuff, but people do just need to be aware that if they have a summer flu, because Lyme can originally cause like flu-like symptoms, as can other tick-borne diseases, that might not be the flu, it might be Lyme or a tick-borne disease. And also, not everyone with Lyme gets bullseye rash. In fact, a lot of us don't. I have no recollection of a bullseye rash, but I did respond well to Lyme treatment and test positive to the antibodies, showing that I had been exposed to it at some point. With the bullseye rash, I mean, I did when I was 10 years old. My mum took me to the doctor because she thought I had a ringworm, because I had a really weird ring rash. It wasn't ringworm. We never figured out what it was. Maybe that was a bullseye rash, just a bit of an atypical one. I'm not really sure, honestly. And I have had bites that have caused excessive swelling, but that's probably more of a histamine reaction from an overactive immune system. But you can have Lyme without bullseye rash. The symptoms are usually identical to things like myalgic encephalomyelitis, also sometimes referred to as chronic fatigue syndrome, although I find that name very invalidating. A lot of people do. A lot of people prefer the term ME just because it shows that it's more than just fatigue. There's so many different symptoms. And also fibromyalgia, it can resemble as well, because Lyme is known to cause pain that moves throughout the body quite a lot. And as well as that, Lyme disease, when it causes neuroborreliosis, it can be misdiagnosed as multiple sclerosis because the symptoms can be pretty much the same, and there can be lesions in the brain in both conditions, so it can be misdiagnosed. And even psychiatric conditions, Lyme can trigger things like PANS, which is brain inflammation, but even when a person doesn't meet criteria for PANS, Lyme treatment has helped some people's mental health, because the bacteria can have a huge impact on your brain functioning. As well as that, I read a story of one woman who they were diagnosed with MS, then Parkinson's, then ALS, and they had multiple multiple neurodegenerative disease diagnoses, but thankfully they eventually found out they had Lyme, got treatment, and they stopped deteriorating, because it turned out it was actually all Lyme. It does make me sad when I read ME symptom lists, because literally every symptom they're describing is not just Lyme, but other like Borrelia strains and co-infections, for example, Borrelia miyamotoi. It does bother me, like, because I almost got an ME diagnosis. I thought I might have ME, but I also thought that if I have ME, then I wished that they would bring to the UK, so because I felt like there was no chance I could live like that. There's no chance that I could have any quality of life. So I do have a lot of anger towards the conventional healthcare system for not testing people with ME for all these different infections, not just Lyme, but also Borrelia miyamotoi, various other Borrelia strains, and co-infections, because I was also reading on an ME symptom list that people with ME sometimes have depersonalization and derealization, which is a Bartonella trait, air hunger, a Babesia trait. I know some people with ME who have consistently low blood oxygen. That can be part of Babesia. So it does anger me that the conventional medical system has a symptom-based approach rather than a root cause approach. They diagnose based on symptoms, leading people to just keep suffering or get gaslit, rather than actually finding the underlying cause of what's going on, which can be a chronic infection contributing to T-cell exhaustion, chronic inflammation, and mitochondrial dysfunction. A lot of people with Lyme get a diagnosis of secondary mitochondrial dysfunction caused by the Lyme, but thankfully that also can be treated. It's just that the conventional medical system doesn't really, so you're probably best off seeing a functional medicine doctor. Some people assume that's quackery, but the reality is that they listen to the studies that link lots of conditions to chronic infections, food sensitivities, and various other factors, and they do very intensive lab tests, not just for infections but other things as well, like mitochondrial function, stuff that's neglected by the conventional medical system that just leaves people to suffer. So I would recommend, if you can, seeing a functional practitioner, not one that just says everything's in the gut or hormones, because there are some who are not very good. There are some functional practitioners who think that if you don't have an gut dysbiosis, which is like an imbalance in gut bacteria, and you don't have hormonal problems, then they won't look into anything else. I know functional practitioners who don't believe in things like PANS or mast cell activation, and that's a bad functional practitioner. Just like any doctor, functional practitioners can be bad, but there are some good ones who will do chronic infection testing, mitochondrial function testing, antibody testing, who are really, really thorough and genuinely just want to find the root cause and help, and will recognise rare diseases and things as well. So just do your research, find one who will actually test for all of these things. I feel like I have been talking for ages, but I just want people to know that there is hope. I literally thought that there was no hope for me, but there is. I am so much happier now. I enjoy my life, and there is a good prognosis for me because I am able to access more treatment over time and get more testing, and I'm just so grateful. And I do just hope that this video gives people that hope, and also just the knowledge of like where to get accurate Lyme testing and co-infection testing. I also want to say that if you have similar symptoms and you relate a lot, or you have ME and you don't test positive or respond to treatment for Lyme or any other strain of Borrelia or a common co-infection, that doesn't mean there's no hope. Other infections like mycoplasma have also been associated with these kinds of symptoms and have been successfully treated with long-term antibiotics. Even chronic viral infections have been associated with these kinds of symptoms, ME symptoms in some cases. I am also going to get tested for those. I forgot to mention it in this video, but I do also plan for that because maybe I might need antivirals added to my treatment protocol. I don't know, we will see. Mold toxicity is also highly associated with ME. Most people with ME have evidence of mold toxicity, and that needs to be looked into. That was really brought up by the mast cell expert I saw, who said that they think my mast cells might be overreacting to mold, potentially causing chronic inflammation. The conventional medical system states that only 5% of people with ME actually recover, but that's likely because the conventional medical system has a symptom management-based approach rather than a root cause approach. Their approach isn't individualized enough. They need to understand that there are many different contributing factors and they will be different for different people. The problem is that the conventional medical system won't test for all of these things or treat them until there are thousands of peer-reviewed studies showing and proving that they play a role, because that's how the conventional medical system works. The problem is that these conditions are understudied, meaning that we're forced to go out of the conventional medical system and find our own answers because we don't have decades to wait to save ourselves. We can't wait for the thousands of studies to come out, so we're forced to just do what we can do and test ourselves and find doctors outside of the mainstream system who will treat us. That's all we can do. The conventional medical system is great for acute crises usually, but when you have a chronic illness, it's like they don't know what to do with you. They don't know what to offer you. You have to find your own answers. You have to save yourself. The strains of other Borrelia, because it's so important to look into this and not let the conventional system keep just failing you with a symptom-based approach and actually get to the cause. So yeah, I wasn't going to let myself die a medical mystery. I was going to find the answers one way or another. So I just hope that this can help people. And I also just wanted to, because obviously in the UK there's the news of the PIP cuts and stuff, I wanted to show why PIP is so essential, because the thing that actually allowed me to afford this testing and treatment, which saved my life and allowed me to have a better quality of life and allowed me to at least start being able to earn a little bit of my own money through book writing, is the money from PIP is what paid for that and gave me some quality of life. So it really saved my life, actually. That's something I wanted to bring awareness to as well. If these PIP cuts do go through, I mean, they have gone through, but if they don't retract them and revoke them, then people will suffer, because people like me won't be able to afford the tests they need that they can't get under the NHS to save themselves. They won't be able to afford the treatments that the NHS refuse to cover because they're off-label or a little bit alternative, or they just have treatment guidelines for acute Lyme and not chronic Lyme, for example. PIP cuts will harm people like myself. I'm lucky now that I've already seen a lot of improvement, but you know, if PIP cuts happened 2 years ago, I don't think I'd be alive right now. So that's obviously something to think about. I hope this video has been helpful and informative in some way. Thanks for watching. Bye.